One, we appreciate you taking time out of your schedule to be with us today. I am excited about the opportunity to share with you some of the work that we're doing to improve access to veterinary care. Uh, a lot of what I'm going to talk about will relate to the United States, but I believe most of the information is going to be quite applicable to Canada. And I will take my time to utilizing some PowerPoint slides so that I can characterize some key points. Feel free, if you have a really burning question, to just interrupt by putting it in the chat, and we will try to acknowledge that question at that point. Otherwise, I do hope that you will be prepared for some dialogue at the end of the presentation, because this is not only a case of my wanting to share information about what we're doing. We'd love to learn from you about the world as you see it. I think that it's important to point out things that I may have said that are problematic or either confusing or conflicts with what you believe, because again, that's how we learn, and I think all of us would benefit from that. So don't be shy. Feel free to do that. I'm going to go ahead and share my screen at this time, and we'll get started. So we're going to talk about AlignCare, but the core of this subject is about access to veterinary care in our communities. I do want to acknowledge our primary sponsor, Maddie's Fund. Most of you are probably familiar with Maddie's Fund. It's a family foundation that has done great work over the decades in animal welfare. A very big influencer in the spay-neuter space, sheltering space, shelter medicine, and we appreciate that they have supported our work. Okay, what I would like for you to take away from this experience today, from what you learn, is first and foremost that pet welfare is actually family welfare. And of course, family welfare means community welfare. This is important because those of us in veterinary medicine and in animal welfare work are quite pet-centric. And that's understandable that we're pet-centric. But we believe that when we put the pets in the context in which they operate in our society, at least the majority of them, then what we want to appreciate is that it's about families. This is true even if the pet is in your shelter, looking for a forever home. It's still about that pet's future family. Second key takeaway is, of course, that many families are struggling to access veterinary care. It's due to low socioeconomics as the primary barrier, and low socioeconomics is really complex because it's more than limited income. It can mean a lot of other challenges. And of course, we also want to point out that, and we'll come back to this, human health benefits associated with pets. So low income people really do deserve companionship with pets. Another takeaway, of course, is that to solve the challenges we have, we really do need to start to work better, more collaboratively. We need to better align our resources and our activities. And resources is people and things. And then how we go about utilizing people power and knowledge and the things that we have, the resources we have other than people. And finally, we'll talk about AlignCare, which we believe provides a structured way to better align within our communities to get better health outcomes. We did a national study and reported on it in December of 2018. And prior to our study, though, we had already come to appreciate that in the United States, that word family had really been redefined by the behaviors of Americans, to the extent that 2/3 of our households have pets. And just for reference, that's more than twice the US households with children. So when we think of these social units called family, we encourage those of us in our work to recognize that most often with families, there are pets in the picture. Our study found that 88% of these families considered the pet a family member. And that was based around the human animal bond. So we refer to them as bonded families. That's just a phrase or a term that helps us to be more succinct when we are trying to be precise about who we should be giving priority to when we're trying to help our community. Why priority to the bonded families? Because of the emotional impacts that lack of access to health care causes. And when there are children in the family, when there are children in the family, the children are often the closest one to the non-human family member. And notice that phrase, non-human family member, it's equivalent to pet. But I think as we start to focus on families, we start to change our messaging that these are family members. They just happen to be non-human. The children are often the closest, and when bad things happen to the non-human member, it can cause adverse childhood experiences, and those experiences can affect them throughout their lives. One last thing about family. Most of us will conjure up an image of what that social unit looks like when we hear the word. And what we want to emphasize is that families come in all sorts of makeups, as you see on these pictures. And because we're talking about bonded families, ironically, some of the strongest bonds actually are with the unsheltered families. So that takeaway is this work is about families, and to the extent that we approach our work going forward that way, it will inform our decision making in a number of ways. Okay, why is it that so many people have pets? What's going on? Well, it turns out that pets afford benefits to humans, both physiological and psychological benefits. There are studies that have been done that show lower blood pressure experienced by people who have pets, fewer doctor visits, increased physical activity. That's probably more a dog thing than a cat thing, but who knows, maybe the cats keep you busy inside the home. Decreased rates of depression, stress, anxiety, and of course, loneliness. This loneliness is particularly important with our seniors because loneliness has poor health outcomes. There has been measured cognitive decline, physical decline with seniors who live in isolation and living alone. And of course, we never usually hear the phrase unconditional love directed at other humans, but very regularly we'll hear this phrase directed at our non-human family members. Increased self-esteem has been measured, and of course, connection to the community, meaning as social creatures, when we're in these relationships, we are better able to exercise our social genes, if you would. But folks, we have a crisis, and you know about this. We're going to talk about the crisis. Millions of families struggle to access veterinary care. Before COVID-19, our national study found more than 1 out of 4 pet owners reported a barrier to veterinary care. Now, you can see here, overwhelmingly, that barrier was because they could not afford it. But let's not underappreciate some of these other barriers that are also operating. Like I said, it's a complex situation when we are talking about trying to improve access to veterinary care. This one is an interesting one. Concerned that the provider would think badly of me. What does that say to me? It says to me that us humans are kind of complex. We're a complex species, and sometimes our behaviors are driven by whatever you want to call it, whether it's embarrassment, shame, pride, whatever is operating. So as we work to improve access to care, I encourage you to be compassionate about those who struggle, because sometimes they are struggling just to get the help from a mental health standpoint. At the time of the report, we also estimated that in the United States, there were about 29 million dogs and cats living in families that participate in the Supplemental Nutrition Assistance Program. That's commonly referred to as the food stamp program. It's a public assistance program. It's operates on tax dollars. So Americans, when paying our taxes, some of those dollars go into helping to feed those who struggle. 29 million dogs and cats. And why did we use this measure? It was simply because if you need assistance with food, you probably need assistance with medical care and other necessities. But let's not also forget the middle class families. In the United States, most middle class families actually live paycheck to paycheck, carry quite a bit of debt in most cases, and not a lot of emergency funds. Now, looking at this primary barrier being financial, of course, our study found that the younger pet owners are more often affected. That was not a surprise to finding. They are young in their careers. Hope some will go on to make much better income. However, the millennials, any of you who are millennials, most experts project that your income will never reach the level of your parents' generation. It's a crappy situation. I get that. But what that means for us in this work is whatever service delivery models we built out of the 20th century, those models are not going to work as well for the millennial generation. Now, what makes this especially problematic is that 2/3 of pets are with two generations in the United States. The largest pet owning generation are millennials. And we just talked about what's projected about the income of millennials, followed by my generation, the baby boomers. And of course, we are retiring onto limited incomes every day. So in our country, then, 2/3 of pets are actually in cohorts that are not going to be able to pay for services in the way that previous generations had. That's a major problem to us. Of course, veterinary costs are outpacing the ability of many to pay, and that's just the way it is. I will say I do not know of any data that supports that shows that veterinarians are literally exploiting the public and getting wealthier and wealthier and wealthier. No, this is an issue of increasing costs to deliver health care. Everything is costing more, and it's outpacing the ability of many to pay. And of course, then along comes COVID-19, and we have now record unemployment. It's projected that the impacts of the pandemic will be felt for years to come. Many businesses will not return, and some that will return won't scale up to the pre-COVID-19 levels. So let's just say we believe that while we had a bad problem before the pandemic, it's exponentially worse. Now, about this time, it occurs to someone often, well, if those people probably shouldn't even have a pet. You know, in fact, this phrase is often heard, at least I've heard it over the years, if they can't afford veterinary care, they should not have a pet. And you know what? That is one of the most logical statements one can make. It's very, very logical. I get that. Those people, though, that we're talking about, and I use that phrase because that's the way I hear them described by others. Let's talk about who those people are. They are not slackers. The largest category are the working poor. And you know what's ironic, folks? The irony is most of them work in service to others. They work in service industries. They help to feed us through agriculture. They work in the food industry. Uh, they help build the homes that we live in and so forth. They work in our shelters and in veterinary medicine. And there are more often women and minorities who constitute the working poor. Now, what I want to emphasize about this group is they're contributing to society. They just happen to be working in industries that don't pay a living wage and therefore need assistance. Then there are the senior retirees, another huge category. These people have worked all their lives. They've contributed in major ways often. I think of our school teachers as an example. Now they're on limited incomes. And then, of course, poverty is dynamic. People fall into and out of poverty in the United States, and I suspect in Canada as well. So sometimes they present during the time they're temporarily unemployed. We've been talking about the food stamp program. 75% of the families in the United States that receive this type of public assistance have at least one worker in the home. And a third of them actually have two or more workers in the home. They are not slackers. And let's not forget those who would work if they could. They are unable to work due to a disability or some other reason. So we ask that let's suspend with judgment when people present needing help until you know the full story. You may very well be looking at the person who's helped to save a big part of society, but now they're in a situation. Another statement about these people who I've been referring to as this perceived or thought to be slackers, or that they're being irresponsible if they have a pet and can't afford it. Our national study found that just over a quarter of the families actually went out and adopted their dog or cat, and even fewer purchased a cat. But as you can see, well less than half purchased the dog or cat. What we're seeing is that there are numerous reasons for families to end up with a pet, yet cannot afford the care. There are behaviors such as a family member becoming ill or worse yet dying, and another family member not being financially ready, taking in the non-human family member. We would embrace that behavior as something that we think is good. Or a poor dog or cat needing a home and a compassionate person taking that individual in. So again, we encourage those of us in this work to just be real careful about judging a person who shows up needing help. One last thing about that is I as a veterinarian I've seen times when someone shows up late. It's like, well, what, you really should have been here last week or days ago. And unfortunately, some colleagues may judge those persons harshly for waiting. But when people don't have a lot of extra money lying around, it is understood that many pray and hope and wait hoping that the problem is going to clear up. And when it looks like it's not, they go in and get help. So takeaway on this is multiple reasons why people are in this situation. It's not due to being irresponsible, being folks looking for a handout. They need help. And hopefully that mindset will motivate us to do the things that we can. Now, so what? I mean, what if healthcare is not available? Let's just touch up on this, and I think this will be familiar to all of you. But for the pet, for the victim, it can mean a prolonged recovery from an illness or an injury. If they're lucky, if they're fortunate. Unfortunately, many will die prematurely. Sometimes that premature death is brought about by way of euthanasia, over money, inability to pay. And then, of course, if you're in a shelter, you see them being relinquished due to treatable medical conditions. So the pet loses his or her family and or dies prematurely, or certainly can suffer much longer. Now, we said this is about families, so we broaden our lens, our focus beyond the pet, and we see the family, the emotional distress, threats to well-being that the family experiences. Because, see, this is a love relationship. When you're connected with someone who's suffering, it does impact you. And the veterinary care teams are even impacted. Anecdotally, what we understand is happening more and more frequently is someone showing up in crisis, pleading for help, asking the veterinarian for help, but not having sufficient resources. And sometimes that results in yelling at the vet, saying, out loud, if you loved animals, you would help me, you'd do something. And veterinarians, guys, are not built for that kind of scenario, especially playing out repeatedly. It does harm to us when we can't help those that we signed up to help, worked real hard to learn how to help. And what makes it worse is if it's all about just some money. So the people around the pet, whether it's the pet's family or it's the pet's potential healthcare providers, are all being harmed by this lack of access to care. And let's just broaden a little bit further to our community. You see, the community is not safe either because of zoonotic diseases in particular. Now, let us recall, a zoonotic disease is a disease, often an infectious disease, but a disease caused by a microbe, an organism that can be transferred from an animal to a human under natural conditions. Often that is through the food supply when people consume animals, but it also can happen by way of our companions or the environment just being contaminated by animals. The point being here is the community is at risk to the extent that we don't actually provide care to the millions of pets that are embedded in our communities. So multiple reasons for us to want to improve access to veterinary care. This is a national security reason right here, the community itself. Well, let's shift to solutions. So low socioeconomics is a complex situation, and this whole scenario that we've been talking about is complex, and complex scenarios like this require a comprehensive approach to solve them. And that template, that model would be what's called One Health. Now, One Health is a new paradigm embraced internationally. What the paradigm says is if you want to improve the health outcomes for humans, you need to factor in the animals, and you've got to factor in the environment or their ecosystem, because all three of these are intersecting on so many levels. Likewise, if we want to improve the health outcome for animals, even if they're wildlife, you need to factor in the impact of humans, and you've got to factor in their environment or ecosystem. So using this template, AlignCare has components that we're going to drill down on here in a bit that's directly focused on the human members of the family, components that relate to the type of medical care provided, and then, of course, the fact that we have to address the ecosystem, which is largely defined by low socioeconomics. Okay? And I don't know if there are any questions up to this point, but if someone has a burning question, just jump in there. What AlignCare is seeking to do then is align our resources, including our people and things, and our activities in new ways in order to get better outcomes. It's better coordinating our work. It's structured. The veterinary medicine industry is built on equality. And equality means that every client that walks through the front door is presented the same fee schedule. And we try to actually treat everybody equally. But everybody doesn't walk through that door from the same starting position. What equity does is it acknowledges that people are different, their situations may differ, and that we need systems that were designed for some of those differences in order to give all people, all families, equitable shots at getting health care. So the program for pet health equity is based on the fact that our mission is driven by health equity. Interestingly, the first line in the veterinarian's oath is that we're going to use our scientific knowledge and skills for the benefit of society. If you look carefully at the United States and the veterinary medicine industry, you will quickly see that our industry is actually built for the middle class. That's the society that we by and large are serving. Yet we have sectors of our society, and certainly since COVID-19, a large sector of our society that we presently are not reaching. And so this is why we're doing the work that we're doing. One other way to look at our society is those who seek veterinary care have a range of financial capability. So there are clients who are quite solvent financially. They can reach into their pocket and pull out cold hard cash or a debit card because the cash is in a bank account and pay $1,500, $2,500 for the services right there on the spot. God bless them. Most bonded families actually fall in the illiquid category. They need some form of financial options like health insurance that helps to defray costs, certainly credit so they can spread those payments out. And we've got a number of instruments that work on their behalf. The people we are believing are in most need of help, however, and where AlignCare is focused at this point, are the clients that are insolvent. Doesn't mean they don't have any money. It certainly means they can't reach into their pocket and pull out $1,500 to pay the bill. Unfortunately, some can qualify for credit, but the credit is predatory. So they get hit with high interest rates. And then there are those who can't even get credit. These are the folks most in crisis. And so we chose to start with a primary focus here, but we are building, and you'll see this in a moment, ways to improve options for the illiquid clients as well. This is the high-level view of AlignCare. Now I'm going to dwell here a little bit so I can help you to understand how the system is designed to work. Essentially, qualified families mean at this stage that they have already qualified for public assistance. These are folks that are most in need of a healthcare system that reaches them, that gets them over here to the veterinary service providers. AlignCare is that system that sits in between the two in order to facilitate this. Our families are enrolled using an app with the help of a veterinary social work coordinator. Well, what in the world is a veterinary social worker? It's a new discipline in social work. Veterinary social work is a specialty area originally where social workers who were licensed social workers could get additional training, get certified around the human-animal bond. So these folks are trained in how to support humans, whether they're the family member or the veterinary service provider, the veterinary care team, around some of the mental emotional health issues that arise around animals. They are trained actually to help that livestock producer who's losing their entire livestock, their entire herd of flock over some disease or mass depopulation type effort. These people are extremely important because they can help the veterinary service provider in so many ways as the providers try to help the families. Where does the money come from? How's this paid for? Well, it's community-based. We've talked about food stamps, a government program based on tax dollars. AlignCare is not a government program based on tax dollars. It's based on the fact that the communities in America, at least, and I believe the same is true for Canada, it's our communities that are responsible for improving animal welfare. So in our country, we used to have only dog pounds. Dog pounds were government facilities where dogs could be picked up off the street and taken to these facilities. It was a rabies control driven program. If someone didn't come and get that dog within 3 days, or it could be a cat, then they were euthanized. It was our communities that said, this is unacceptable. We've got to do better than that. And that led to the building of a really robust animal sheltering industry system. What makes it so robust is aggressive spay-neuter programs in many communities, adoptions programs. So the thinking is you hold the individual until you can find them a home, get them adopted. Shelter medicine, so those that need a little medical care, get them ready. You all know what this is all about because you work in the industry. So it's leveraging that same community mentality, mindset to say, now we've got to step to a new level because we have so many families now that are not being able to stay together over lack of access to health care. Some of the money now needs to go towards subsidies to help pay for the veterinary care. Veterinarians can't do this for free. These are small businesses primarily outside of the shelter industry. They have very little bandwidth to give away services. So there's clearly a need for some money to come into the mix. But this system also appreciates the reality of the family. Remember, we said you got to look at the humans. You got to look at the human members of the family. There's a need for better education so they know how to make better decisions to keep their non-human members healthy. There's a need for virtual health care. You know, the working poor in our country don't have paid leave. When they have to take off to go back to the vet for a suture check, they don't get paid when they leave work. Some have to pay out of their pocket for transportation to get to the vet's office for a 5-minute visit where they're told, yep, it looks good, just let us know if it changes. So we are a very big believer in the need for virtual health care to lower the cost for families. And then, of course, we mentioned financing. They need options that work for them, that are not predatory. And you know what? They don't even have a health insurance option. And we'll come back to that. So just to wrap up, AlignCare is actually a system. It's structured, and it's structured so that we can have consistency, predictability, and of course, be able to control costs in the process. Let's talk a little bit more about controlling costs. We work with companies to get discounted products, and of course, our veterinary service providers discount their services if they're not a low-cost provider. We do have caps in coverage because if there's a very poor to great prognosis, under AlignCare, only hospice or palliative care is covered, and then euthanasia. Now, what's the principle here? The principle here is, as much as I love my dog, if my dog has advanced cancer and it's going to take $5,000 for my veterinary service provider to get my dog another month, maybe 3 if we're lucky, 5,000, but my dog is going to die. Under AlignCare, we believe that $5,000 would be better served by being directed at individuals that have a life ahead of them. So we don't cover that $5,000. Rather, we counsel the family through our veterinary social work program. We don't just leave them hanging. I've mentioned virtual healthcare as important ways to control costs, and of course, the education piece. Right now, our families can pull down valid and reliable information so that they can make better decisions about proper care. And we're working on InfoRx so that when the veterinarian has diagnosed a particular condition, we push information to the family to give them more of an understanding of what the problem is. This is because veterinarians operate in this country on 15 and 20-minute appointment windows, and they have about this much time to explain things. And of course, if the family is struggling to comprehend some of the information, they get rushed out. A healthcare system that's um, more friendly and compassionate would make sure that they could still get access to information that's going to help them. So controlling costs also falls into the arena of incremental veterinary care. Now, what is that? It's the other side of the coin from gold standard veterinary care. Gold standard veterinary care is wonderful when you can pay for it. You got all wonderful kinds of diagnostic testing done and all wonderful sorts of advanced procedures done. But if that's all you offer a family that has limited means, that becomes the barrier to any form of health care. It's the incremental approach to the patient that we are advocating. Still patient-centered, still evidence-based medicine, but it's in the context of limited resources. It's a tiered approach to the patient management. You don't start with testing that's not absolutely critical. Focusing on wellness and preventive care because a healthy family is more affordable for themselves and a nation than a sick family. Um, Avoiding these non-critical things that often get done. Again, recognizing there needs to be caps so that the money goes a lot further, helping a lot more families. That a system like this, incremental veterinary care, means that we factor in the family's capability to follow instructions, to be part of the treatment plan, or, in other words, work that things that they can do in their home that would be a lot more affordable than having to come back to the vet for that particular step. And of course, I've mentioned technology. This is a conceptual image of incremental care. Basically, as I've already said, our coverage on wellness and preventive care is for everything that's medically recommended to be done. It's when you start to get to really complicated problems that are associated with very high costs that the coverage starts to drop off. If you build a system to try to reach all the individuals out here, it will lead to the death of many that could have lived a full life because those dollars could have helped them. And so it's tough love, but our veterinary social work coordinators support our families along that line that I'm showing right here where coverage drops off. Cost is shared. I'm going to hasten here now to start wrapping up. Cost is shared among multiple parties, starting with the families. Most families want to do as much as they can for themselves. They're not looking for a free ride. They need help. And so we are right now testing a 20% copay. Through time, we may find that needs to be adjusted. If the family doesn't even have a 20% copay, we look to an agency, a social service agency in the community, to cover that for them. And then in some cases, it gets waived altogether. We ask our veterinary practices, if you're not a low-cost practice, discount your fees by 20%. We're testing that out. Can we get enough practices to be part of a healthcare system with that level of discounting? Of course, the drug companies could provide discounts for these families. And then there's the AlignCare fund in the room paying the bill as well in the form of a subsidy. We're working on better finance options, so that industry has a role here. And of course, we just recently issued a request for proposals from the pet health insurance industry. We want to see customized pet health insurance policies for low-income families, for the working poor. Suffice it to say, it does take a village to raise a child. It takes a village to ensure access to veterinary care for all who deserve access to care. And it's a matter of having everyone chip in financially to make that a reality. Other cost sharing is into the future, but we are anticipating more corporate policies that will feed funds into this healthcare system. So if you could just imagine businesses, small, medium, and large, where some small percentage of sales, if you would go into, the funds would go into a national healthcare system, then these small doses start to create big impact. The public could participate if these businesses at the retail level would give them a checkout charity, and that could be online like Amazon and beyond. But here the public is rounding up to the next dollar. Small contribution, but on a mass scale starts to result in major impacts. And we need corporate employee benefits plans. In this case, a pet health savings account. So a few dollars out of every check goes into a pet health savings account, and hopefully the company will match those funds or at least contribute, add to them a bit. This gives an option to that family at the time then that health care is needed. We're doing some public health research, population research regarding health outcomes, because we want to appeal to the human health insurance industry and government programs that pay for the health care of humans, that it would be wise for you to make sure the non-human members stay in the family. And we might use that senior that I mentioned a moment ago. If the senior has a need for health care for the non-human member and doesn't get it, the senior goes into conditions, a state of loneliness at that point. Also with the trauma, the emotional trauma and all of losing a family member, that individual's healthcare costs are going to go up for those who pay for the healthcare. And it's a combination of government and private health insurance companies, human health insurance companies. We believe our research will show that the benefits of these bonds, these bonded families, is such that the little bit of money that would go into paying for the health care of the non-human members saves them huge amounts with the humans. That case has to be built. One day we should have Medicare Advantage plans for seniors. That's something that gets paid in while you're working, let's say. And then when you're in your retirement years on Medicare, that your non-human family members will benefit from health care. Where the government does have a role as well is, of course, tax programs. A lot of veterinarians who'd love to work for your shelters or for nonprofits that can't pay a lot, they can't pay, the veterinarians can't work for you because they have an education debt that they've got to serve. You know, the average is $187,000 in debt when veterinarians graduate. So we need better tax programs that will incentivize the veterinarians who want to help to be able to come in into your organization and help, or to provide discounts to the families that we've been talking about. In the end, yes, there's a way to balance the financials with all the parties we've been talking about so that everybody can get access to health care. Right now, and I'm wrapping up, we started a pilot project in these 4 cities in the United States. We are now underway in implementing AlignCare in Nevada, specifically Reno and Las Vegas, but we have plans to also reach some rural parts of Nevada and, of course, Buffalo, New York. We still see high priority for these other cities that you see here with the amber stars. Now that list can change because, like with Nevada, a sponsor can step forward and say, we want to fund implementation in this community or this state, and that's where we will end up going if that's where the dollars are being made available. Everything I have said can apply to Canada. As a Western nation, you're very much like the United States in almost every respect around this issue. And my final slide would be resources for you to access. This is our website shown at the bottom. This document is the report from the national study that I've cited a few times. Last year, we held a symposium on access to veterinary care, and there's some important information there, including um, uh, fundraising ideas and messaging and so forth that might be helpful. And of course, finally, and probably more importantly, is the AlignCare Community Manual, because the system that I've been describing is actually spelled out in detail in this document in the policies and procedures that appear here, including incremental veterinary care. No, it doesn't tell the veterinarian how to treat the patient clinically. We think most veterinarians know how to do that. But it does present the framework in which we think the decision-making needs to take place as you go about treating patients in the context of limited resources. Okay, on that note, I am actually going to stop sharing my screen, and hopefully we've got questions and challenges, you know, or just points that anyone would like to make. Just feel free to have at it.
Our first question, Dr. Blackwell, do you have any limits on number of animals treated per family? How about any requirements for spay-neuter? Example, people who access low-cost clinics but then come back for litter after litter.
Yes, very, very important question. And yes, we do. So at the time of enrollment, a family can only enroll up to 4 pets. Once they're enrolled, they're not able to go get additional pets to add to the family, okay? And that's simply because there's limited money to start with. But up to 4. We strongly encourage spay neutering, and so that is a policy area as well. Now, of course, if it's not medically recommended because based on a veterinarian's judgment, then that does not happen. But that is an expectation. Through time, we may play around or have to adjust that number of maximum, but that's twice the national average. The national average in the United States is 2 pets per family. So we believe with our policies, and especially through time, we're going to help nudge those decisions to spay and neuter those pets. Thank you for the question.
Our next question, how do you track and report on who you support, by person, by animal, by family?
All of the above. So we are collecting gobs of data. At the time of enrollment, we learn who makes up the family, both the humans and the non-humans. And while the family can only enroll 4 pets, up to 4, we do capture information about the balance, because in some cases, the family that's already financially unable to pay for care is in over their heads with multiple pets. That's why we love our veterinary social workers, because they know how to engage in those conversations to help that family through time in their decisions to get into a better situation. We are collecting information about what diseases are diagnosed, what it actually costs based on the incremental veterinary care model. Now, our IT system is not fully developed, but eventually we will be electronically connecting to the medical record system of the practices so that we can collect that key information out of their medical records without them having to do anything. I hope I answered your question, and if I left out something, please please come back with a follow-on.
Next question. Do you have to advertise or do you target certain communities where the need is greatest?
So we are not advertising, and it's simply because technically the AlignCare project is still a research project. It's in the the demonstration project phase, the proof of concept phase, where we're now in the community testing out the ideas that we spent more than a year developing that are in the community manual. Um, Through time, the future we envision is a future where every household in America is aware of that healthcare system for bonded families with limited means. And in fact, they're participating in putting funds into that system. And in that case, uh, advertising or marketing or educating will shift to a whole new level and more aggressive level. So right now we share AlignCare in fora like the one today. And some of you will go back to your community, and your community hopefully will reach out to you, us, and say, we're interested in trying to get AlignCare started in our community. How do we do that? And we'll start to work with you, but it will come down to available funding to pay for the care, because the biggest lift is subsidizing the payment for medical care. However, again, our system is trying to control those costs and spread those costs among many.
Thank you. Okay. What would you consider the best way to train veterinary students in incremental care?
Whoa, I really, really appreciate that question. I don't know if that's a veterinarian that's asking it, um, but we have a problem in veterinary medical education. I will call it a problem. And the problem is this: when my dad trained in veterinary medicine, and when I trained in veterinary medicine, a lot of our clinical faculty, those who taught you how to treat patients, were former general practitioners. Heck, when I trained, we didn't even have specialists to speak of. I don't know what's a specialist. Well, through time, many in the United States wanted higher and higher levels of medical care for their non-human family members. We had a more robust middle class back in those days. And veterinary medicine responded, and we evolved into multiple specialties, just like human medicine. And it turns out through time, everybody who's teaching you how to treat patients in the veterinary colleges are specialists. And guess what level they teach you to treat at? So the problem that I'm referring to then is, yes, the curricula in veterinary medicine have become so skewed such that students, more recent veterinary graduates, and the ones that are seated today, are not getting as much of a general practice of medicine training as the communities need. So we hope to influence that. We actually have built a coalition of universities, and we'll be adding to that coalition, but we want to develop curricula that hopefully veterinary colleges will take on, and even if they don't, continuing education curricula for veterinarians that want to learn this general practice of medicine approach. And by the way, guys, it's not lower quality medicine. It's actually evidence-based medicine, but it's relying more heavily on the fact that a veterinarian is taking a great history, doing a tremendous physical examination, and then able to engage in deductive reasoning and rationalize, and not rationalize, but analyze the data and come up with a treatment plan based on what is likely going on. Those diagnostic tests that you can do, they are preserved, or reserved, I should say, to be used if the patient doesn't respond. And I like to use the vomiting canine. I want to contrast gold standard medicine, which is what the veterinarians are being taught today, versus incremental. So my dog vomited twice yesterday. And being a concerned parent, I'm in today with my veterinary care team. Now, they've just taken a history and learned that my dog actually ate a little bit of breakfast this morning. And they've just done a tremendous physical examination and determined it's unremarkable. No sensitivity in the abdomen. My dog is sitting there smiling at everybody. He's a happy camper, enjoying the vet visit. Well, here's what happens in gold standard medical care, which is great medical care. So I'm not dismissing it. A veterinarian may be inclined to say, okay, I don't see anything going on, but we could be having here the beginnings of either a change with one of the organs or an early infection that's underway. So we're going to take blood, make sure none of that's going on. And she could have swallowed something in the yard. That could be a foreign object. So we're going to take an x-ray just to make sure. And while we're back there, I think it would be great if we did an ultrasound, because sometimes the ultrasound picks up things that you don't see on x-ray. Guys, this is great medical care, and there are a lot of people in this country who want that level of care and they can pay for it. But if that's the only thing you offer some of our families, you've just created a barrier to care. Now, what incremental care does, it says history, exam. I think this is a typical episode of just got an upset stomach. I'm pretty certain it's not life-threatening. So what we're going to do is watch and see what happens, In fact, if you really are concerned, we can send home this very inexpensive nausea drug just to make sure. But call me tomorrow if anything changes. The bills for these 2 visits are immensely different. And so incremental care is that general practice of medicine approach where you use your noggin. You say, I've got the evidence based on evidence, and then we're talking about medical evidence that's in the literature. This is probably not a big deal. And we'll start there and go from there. So I didn't mean to go into that much detail, but it was an opportunity to actually help to, again, contrast gold standard versus incremental care. And our future veterinarians back up. Every school I've gone to, students are expressing alarm and anxiety about the fact that they're not being taught that way. So there is a problem that's going to need to be addressed as far as veterinary medical education. Thank you for the question.
That question was posed by one of our shelter veterinarians.
You know what? Since you're a shelter vet, let me just say something to you that sounds patronizing, but it's not. You guys are the ones practicing incremental veterinary care. You're the guys that often get looked at as not, you're not a big time veterinarian. So it's what you all are learning about how to make the most with little that we need more veterinarians in the private sector to be doing, because if they don't do it, we'll still have these barriers to veterinary care. So thank you for what you do at the shelter. I really, really respect you guys. I think you're the top guns.
Yes. Next question. I work for an animal welfare group that is not yet ready to invest in bonded families. Have you worked directly with the human services organizations that serve marginalized populations and add this amazing service outside of animal welfare groups?
Oh, absolutely. Thank you. So initially, when we started the demonstration project, a family could only enroll through one of those agencies. And the reason for that is there is a need for a formal connection between what we're trying to do with non-human family members and what others are doing with the human members. There's a need to exchange information. There's a need to see this family holistically. And so we were only enrolling through social service agencies. And guess what? The one in Asheville, it was a Head Start program. It could be a senior program like we have here in Knoxville, Tennessee, or in Phoenix. It could be one of domestic violence, or where people suddenly are temporarily unsheltered. And that agency is trying to address the needs of the family. So we can go across the board, and you can throw a dart at a board that is populated with social service agencies, right? So their names all over the place. And you can throw that dart 100 times. And I'm telling you, 100 times, it's going to land on an agency that serves families that are bonded. And why is that? 2/3 of households in America are bonded families. So it may not be 100%, but what we're saying is no matter what agency you approach, from infants to seniors, from housing to food to transportation, they all are serving the families that we're trying to help. So we're in the same business.
Thank you. Next question. How do you address the physical access for families with pets as the second highest challenge for accessing care?
Okay, could you just restate that again? Make sure I got it.
How do you address the physical access for families with pets as the second highest challenge for accessing care?
Got it. So that's a complex arena, meaning there can be multiple reasons to fall into that category. So in the case of families that don't have transportation, some of the agencies we work with provides them transportation. And it's not new business for them. That's what they do to support their families. If the human members need to go to the doctor and they don't have transportation, those agencies assist them with getting to the doctor. This is just a different family member that we are indicating they need to take care of. And why would they want to do it? Because if their human member that they're supporting is starting to struggle because of what's going on with the non-human, it's just going to increase their burden, their workload in some way. If it's because of language or comprehension, and we do have families that have some cognitive challenges, and the agency, of course, steps in as an agent on behalf of the family, if not our social workers. So I guess the short answer to your question, it depends. I think the takeaway is almost no matter what it is, it's addressable if we choose to align our resources in order to address it. Oh, by the way, we do need better public policies in America so that people can go onto public transportation with their non-human members, because that's another barrier to care. If I've got to spend $25 to get someone to bring me to the vet, and that's 3 times what I would have had to pay on, maybe 5 times what I'd pay for public transportation, that's an option that needs to be available. You would be probably interested in knowing about what happened in Sao Paulo, Brazil. They now have 3 public hospitals, veterinary hospitals, which, by the way, are supported by tax dollars. But in order to address their families that were being underserved, their community decided, yeah, some of the money we pay to the government needs to support a public veterinary hospital. They started with 1, and finally they're now with 3, and I think they're going to eventually have 5. Well, once that got started, the transportation issue surfaced. Guess what those Brazilians did? They changed the public laws so that people could bring their non-human members onto the buses to get to the vet. So an advanced society like we claim we are in Canada and the United States, when we see all of our members of the community and we see these are the issues that prevent them from getting health care, that's what we start to address through new public policies. I hope I even answered that person's question. It was a good one.
Yes. Do you find that there is more need for cats than dogs? The reason I ask is that I ran a program with money from a competition for low income to access vet care, and I found more demand to help cats than dogs.
Yes. Well, in this country, in the United States, the cats are the largest. That's the largest pet, or the number of cats is the largest in this country. Not far ahead of dogs, but that's the number 1 pet in the United States. And that trend will probably continue. And we won't get into community cats here, guys. I know you guys know all about them. And there are people who do work to help those community cats. They feed them and they try to get them vet care. I'm just wanting to say, we're looking at the families because that's where the bond is such that mental, emotional health impacts start to happen when there's lack of care. Uh, I think the best answer to your question is, you know what, every community is different. And we would encourage every community then to look carefully at what's unique about you, what do you share in common with others, learn from others where you have common um, characteristics, but then don't be shy about addressing your community situation. Um, at the end of the day, they all count. They all are important, whether they are a dog or a cat.
Thank you. Will there be any advocating for individuals with service dogs needing assistance with veterinary care for their animal?
Yes, so very big need, and that need is going to grow as personal assist animals, service animals, uh, therapy animals, um, as they become more and more integrated in society, then yes, that subgroup of our population is going to need special attention. Now, on our map, you saw, you may not recall, but Raleigh, Durham, North Carolina was one of the communities. That's because of the veterans population and our partnership with agencies, an agency in particular, that works to help veterans who have service dogs, it's generally dogs, to get veterinary care. You know, some of those veterans actually are battling or living with depression or anxiety, post-traumatic stress disorder, and their service animal. And I still struggle with service animals because we talk about families. So we see them as their non-human family member who has got a job, a special job in the family. But they are important to the well-being of those veterans. We've met with the VA hospital in Raleigh, Durham, and it is the largest Veterans Administration hospital in the country. It certainly serves the largest veterans population, and they are quite interested in working with us. Now, here again is a social service agency that we reached out to early on to partner with, which is what the model is about. It's One Health. It's got to connect with the human side. So besides there, in every community, yes, we are encountering families where there is a non-human member that actually has a particular function job in the family as a service animal. And they are particularly important to get enrolled.
Thank you. Are there any restrictions on what species of pets you help?
Yes, the restriction is driven first and foremost by the services provided by the veterinary service provider. So if someone is literally bonded to a snake, I have to pause there because I still have to get my head around that one. Okay, I don't have a family member that's a snake, all right? just to be clear, but people do. And if our veterinary service provider who's in that community enrolled as a provider does not see snakes, then the family is going to have to seek other options. And the limiting factor here is they may go across town and find a veterinarian who will treat snakes, but if they're not in our system, they can't be paid by us. So it's a practical barrier in that sense. What we do not include at this point are hoof stock, livestock. And yes, there are pet cows and certainly pet pigs, and I don't mean pot-bellied in this case. And horses are companions, you know, by and large in this country. That's work we've got to build toward going forward. We decided to start where 80% of the pets are, and 80% of the pets are dogs and cats in this country. And we had to build a system that was going to at least address the 80%. We do have in Long Island, one of our veterinarians in that practice, Long Island, New York, is an avian veterinarian. So Any of the families that have parrots or other avian are able to get care at that veterinary service provider. Practical limitations, not due to a particular bias against a particular species.
When developing partnerships with social service agencies, do you focus on ones that work with any specific community groups, such as BIPOC focused organizations?
So I'm not sure of the acronym, but I do know that it probably won't change the answer to my question. And that is, yes, all agencies that support families, and often it's one part of the family that they support, but all agencies that support families are suspects, meaning I suspect that they actually would agree that they benefit from being aligned with members of the community who are helping with the non-human members because they're seeing families with non-human family members. Beyond that, it becomes a direct, really personal experience. So the relationship that's built is based on the personal connection with that agency, bringing them on board through giving them an update on an overview of the system, helping them to understand what their role is. There are documents in our community manual that they would want to read, including a collaboration agreement, so they understand the expectations. We've thought through all of those kind of materials which are in that community manual. So I would advise you to go there, but it's very much a personalized approach, not a cookie cutter approach to how you approach that agency.
BIPOC stands for Black Indigenous People of Color.
Oh, I thought I missed the whole acronym. Well, thank you for that clarification. I did know that. I recognize that. And let me make sure I didn't miss part of your question. So I see it on the screen. When developing partnerships. So I can tell you right now, we've not approached an agency that just services Black folks, Black families. However, in our work in Nevada, we know we want to get to the so-called tribal lands. And in that case, we start to work with agencies that are actually dedicated to working with the first population here in the United States. I hope I answered the question.
All right. Next question. Would you potentially look at applications from Canadian organizations to participate in AlignCare and launch here in BC? Are there manuals posted available for other programs to look at for best practices?
Yeah. So I think there's a growing body of information out there besides our website. I think our website will have the most robust materials. I think you'll find a lot of information on our website, and starting with that community manual. But others are starting to add to this knowledge base. We want to do what we can to help Canada to become an AlignCare country. Again, our vision is that the United States will have a national healthcare system called AlignCare, which is for bonded families with limited means. It's funded by the private sector. I think the exact same system would be totally appropriate for Canada. And we want to share what we can to help that happen. I think where it gets a little bit trickier is how do you want to handle the funding? So right now, our funding is centralized. If funding is received for a specific community, like for example, we just announced a $600,000 grant from the Dave and Cheryl Duffield Foundation. That grant is specific for the state of Nevada, starting with Vegas and Reno. So I said all that to say, we hope that you all will reach out to us and continue to dialogue. If nothing else, we might be able to help you to avoid some pitfalls and some landmines and some other things. But Align and AlignCare was about aligning our spirits, aligning our minds, aligning our resources in ways that we get these better outcomes. So we're here, and we hope to hear from you.
This isn't a question, more of a comment. I'd love to implement this program in Colombia. However, our system does not work like that. I thank you for this talk, and it has given me lots of ideas.
Oh, well, thank you very much. Is that Colombia? It's not Colombia, South Carolina. I mean, South America. Where's Colombia? Is it British Columbia? Is that short for British Columbia?
South America.
Okay, I thought it might be. Thank you for the question. I actually know the person that came from and have been communicating with your doc, and I hope we'll continue to talk about how to do something in Colombia, because there's no reason we can't have a modified approach, because there's some core principles in our work that totally apply to your challenges there in Colombia. I look forward to us connecting, by the way.
I believe that's all of our questions. If you have any last questions, please put them in the chat.
Great, thank you so much. Thank you, Dr. Blackwell, for taking the time today. I know you are 3 hours ahead of us, so it's into your dinner time now. So I appreciate you taking the time on a Saturday evening to present and to have this really important discussion with us. You and I have had a few conversations that I've just been so appreciative of your mentorship and your knowledge that you're so willing to share with all of us. So thank you again, and thank you everyone for connecting and having this important dialogue. And we look forward to more conversations around this. It is something we're just looking at in British Columbia and across Canada, and really grateful for the work that you're doing that we can use as a modeling for us moving forward. So, and this, as you all noticed, this was recorded, and so I will ask Teresa if maybe you can send a link out to all of the registrants. I know there are many people that didn't register that didn't attend, and also if we have permission to share it with our colleagues. I think there's a lot of people that we would like to share this with. I'm thinking about our veterinarian on our board who works today, so isn't able to attend, but would really like to listen to this conversation.
Yes, we will also post that link on our social media as well as our website, but we will make sure that we send it out to everyone who attended today. Thank you, everyone.
Thank you, everyone.